The state government has announced the details of its plan to break up Queensland Health, splitting it in two in a bid to make the monster department more manageable. Health services will be separated from the bureaucracy and hospitals throughout the state will be run by local boards. It's a major piece of business the state government had to deal with before launching the election campaign, an announcement that could be only days away.
It was an idea first floated in the aftermath of Queensland Health's most recent disaster, the alleged embezzlement of up to $16 million by a high-ranking executive. But it also brings Queensland into line with national health reforms.
The biggest decentralisation of any Queensland government department in the history of this state.
Accounting firm KPMG was given the job of analysing the carve-up of an $11 billion department.
You need to separate the organisation that's purchasing the services or funding the services from the organisation that's delivering the services.
They've proposed splitting it into two departments, health and hospitals to provide patient care and corporate services for payroll, finance and computers. 17 regional boards will run Queensland's hospitals.
I want the people who run our hospitals to focus on patients. And I want a back-of-house group that focus on our staff and give them the services they deserve.
7,400 jobs will go from head office, staff redeployed to the new agencies. But doctors say separating the bureaucracy from clinical services doesn't necessarily improve things for patients.
Cataract surgery is not happening in public hospitals now. I think this has been driven by a bureaucrat making that decision. Doctors understand that patients need the cataract surgery to prevent other much worse things happening at much greater expense.
The opposition says it could be double the trouble.
I don't know that it does make sense. Having two dysfunctional departments replace one dysfunctional department is not about delivering better health services and better health outcomes for Queenslanders.
The KPMG report was due to go to Cabinet on Monday for discussion. Its early revelation clears the decks for an even bigger announcement on Monday, the date of the state election.
In the crucial seat of Ashgrove, the campaign is already running hot. Labor's Kate Jones will tomorrow launch her community campaign office where she hopes to stymie Campbell Newman's push for the premiership. And the Wilderness Society is concerned about the LNP's plans for wild rivers.
The environment is going to be absolutely critical in this electorate of Ashgrove.
The crocodiles are already on the hustings. Karen Berkman, ABC News.